My name is Yosuke Kita, Senior Coordinator for Global Health, International Division of Ministry of Labor and Welfare, Japan. This is a preliminary translation of Minister Kato's speech today. The government headquarters for novel coronavirus infection control was held earlier today, and the Prime Minister instructed that the Minister of Health, Labor and Welfare should play a central role to promptly develop the comprehensive basic policy for how to provide information to the people and the private sectors, preventing the spread of infection and develop the health system to deliver necessary medical care. Regarding the current status of the new coronavirus infection, 132 cases have been reported in Japan to date, and recent cases have revealed at this time. For a large proportion of the recent cases, the clear routes of transmission have not been identified and small clusters of patients has occurred in some areas. As you see in this slide, we distributed. Now is just the turning point between the normal pink line and the thick pink line in this slide. Considering the current situation in Japan, number one, this means that controlling the speed of increase in a patient at this time as much as possible is extremely important in controlling future epidemics and will also reduce the peak of epidemics. Number two, this period can also be utilized for the preparation period for strengthening the health system for responding to the possible substantial increase of patients in the future. Based on those recognitions, for the purpose of minimizing the increase in the number of patients as much as possible, we will promptly develop basic policy including the perspective for the further expansion of transmission in cooperation with the relevant ministries and agencies and clearly show it to the people in Japan. An expert meeting will be held at tomorrow morning, 10 o'clock, and the basic policy will be discussed. Regarding the passengers on the cruise ship Diamond Princess, those who have negative PCR test result, except those with positive result, and those in the same cabins disembarked sequentially from February 19 until today, after checking their health status, and totally 982 people have been disembarked so far. However, yesterday there was a case who has a negative test result before the disembarkation, but afterward became confirmed as positive result in Tochigi Prefecture. Considering this case, the Prime Minister instructed further strengthening the follow-up of the health status of passengers who disembarked from 19th February in today's government headquarters meeting, while we have already requested them to refrain from going out if it is not urgent. Sincerely considering the fact that a positive person was confirmed after disembarkation and the Prime Minister's instructions, we started the following operations for close follow-up of passengers after disembarkation. Number one, the distribution of circular to notice that health checkups after disembarkation should be conducted on a daily basis. Number two, sharing the information of the passengers after disembarkation not only with public health centers, but also with the prefecture level. Also, yesterday, February 22nd, a case of a new coronavirus infected a staff member of a nursing care facility in Tokyo. Elderly people are more likely to become serious situation, so it is important to take through measures to prevent infection at facility for the elderly. So number one, employees should measure body temperatures before going to work and ensure that they do not go to work if symptoms such as fever are observed. Number two, restrict visit to resident unless urgently necessary and refuse visit if symptoms such as fever are observed. Number three, measures the temperature of the person when picking up and dropping out the day service user and refuse using if symptoms such as fever are observed. We will issue our business communication including these points to the local government that summarizes important points to prevent the spread of infection tomorrow. This is an important time to prevent the spread of the new coronavirus infection. If you have a cold-like symptoms, we ask you to take a break from school and work, refrain from going out, and cooperate with actions such as hand washing and through cough etiquette to prevent the spread of the infection. With the cooperation of the people, the Ministry of Health, Labor and Welfare will continue to do our utmost to prevent the spread of infection in Japan, to protect the lives and health of the people. Thank you very much.